Angelicus and its Equations here. Sperb.
Hello and welcome to episode 32 of Sperb Herbs. Today we are going to be talking about Chen Tang, or two-aged herb decoction. So let's get into it. So today we will be looking at a very important formula, Chen Tang, or two-aged herbs formula, or sometimes you'll hear two-cured formula referring to herbs. This is a very foundational formula, and many other formulas are based on it. So continue listening, and we will get to this important information. And of course, we will have something a little different. We will be discussing what is phlegm from a Chinese medical perspective. We'll see why that's important when we're talking about this formula. So, before we get into it, just want to have a little chat with you. Have you ever wanted to give herbs to a patient on drugs? Do you have the knowledge and tools to do that effectively and safely? I am finishing up my drug herb webinar series, which gives you real-world tools in answer to these questions. As a beginning, the first course will give you an in-depth overview of how drugs, and by the same token, how herbs work on the body. The second focuses on drug-herb interactions and gives you a unique, powerful, real-world tool for assessing them. This knowledge should be in every practitioner's toolkit, so I'm going to give you these first two courses 6 hours of CEUs for 30% off the already regularly low price. Just go to integrativemedicinecouncil.org/32. So that's Integrative Medicine Council, COUNCIL.org/32 for this episode 32, and get your discount right now. But please hurry, this is a limited time offer. All right, so let's get into our little something different today. Today, we are going to be talking about phlegm, which is considered an internal pathogen. And because the formula that we're doing, its main job is to treat phlegm. So let's understand a little bit about phlegm before we get into it. So phlegm is an internal pathogen. Internal pathogens or pathogenic factors. Sometimes you'll hear them as internal pathogens, or other times as pathogenic factors. There's probably not a whole bunch of difference between those two translations. Are either internally generated or transformed from an external pathogenic factor. There are 3 exceptions here where an external factor can directly go interior without going through an external stage. These include invasion of cold in the stomach. Actually, all 3 of these are invasion of cold. First is invasion of cold into the stomach. The second is invasion of cold into the intestines. And the third is invasion of cold in the uterus. So right there, one thing with these external pathogenic factors, cold can penetrate. But we're not talking about cold today. We're talking about phlegm. Those are just examples of internal pathogens. So let's get into phlegm. So according to Maciocia, if you're not familiar with Maciocia, he has written the fundamental textbooks. I don't know a school around. There's one other major textbook, and most schools will use both actually. So as foundational textbook for Chinese medicine, like the first textbook that you'll get into. So Maciocia is a big one. And here's some quotes from him. Phlegm is a very important and common internal pathogenic factor. It can be involved in and cause serious conditions such as cancer, heart disease, and stroke. Phlegm is at the same time a pathological condition and an etiological factor. In other words, etiological means a causative factor, as it can be retained over a long period of time and become a cause of disease. So it is a disease, it's a pathological condition, but it can also cause other pathological diseases as well, such as cancer. Phlegm in and of itself is not going to be cause of a cancer, but phlegm that's been there for a long time, mixed in with blood stasis potentially and some other things, then we have the potential for a cancer to form. The main cause for the formation of phlegm is spleen deficiency. So spleen is a very interesting organ. It's probably one of the more important organs. I mean, you could make the case that every organ is important, but spleen is where we get what we call our post-heaven qi. So this is very important in Chinese medicine. And if you're really into Western medicine, you might be scratching your head. It's like, spleen, that important? And the reality is, from a Western point of view, the spleen is not an incredibly important. It's part of the immune system. It's part of the lymphatic system, and is useful in that. But we can take out the spleen in Western medicine and not worry about it at all. But in Chinese medicine, spleen is incredibly important. It's actually considered the main digestive organ. Now, if you're thinking this from a Western point of view, you're scratching your head. Like, the spleen has no effect on digestion whatsoever, according to Western medicine. But in Chinese medicine, there's no such thing as a pancreas. In fact, there is a Chinese book around 1600s that describes the tail of the spleen. And if you know the spleen, what it looks like an oddly shaped balloon. There's no tail to it whatsoever. But right below it is the pancreas, which is very triangular shaped and could be considered a tail. So when we are talking about the spleen in Chinese medicine, we're talking about a spleen-pancreas complex. And then if you look at the pancreas and its role in digestion, you very easily understand why, if we are putting those two together in Chinese medicine, why the spleen is so important for digestion in Chinese medicine, because the pancreas, of course, does all the enzymes that break down the food. Without the pancreas, you need to supplement those enzymes, which we can do these days, not perfectly, but we can do pretty well. But you will not survive without a pancreas. You can't eat without a pancreas, at least for most of human history. So spleen deficiency involves the pancreas as part of this whole process, and that makes a bit more sense when we're talking about it as a digestive organ. So when it's deficient, it's not doing its job well. And if it's not doing its job well, then things aren't moving and digesting and things along those lines, and that's what we do. And that's when phlegm comes in. One of the roles of the spleen is something called transform and transport body fluids. Again, this is a very Chinese concept, but when the spleen is deficient, it fails to transform these and transport these body fluids, and they accumulate and change over time into phlegm. So initially, we often will say there will be a damp forming, which is sort of a stagnation of these body fluids, but as they congeal and there's a little bit of heat and it starts to get a little bit thicker, then we get into phlegm. So dampness will go into phlegm over time. And that's what we're talking about here. The lungs and kidneys are also involved in the formation of phlegm. If the lungs fail to diffuse and make fluids descend, and if the kidneys fail to transform and excrete fluids, these may accumulate into phlegm as well. The essential signs of phlegm are a swollen tongue body, a sticky tongue coating, and a slippery or wiry pulse. So these are all, again, sort of technical Chinese terms. So swollen tongue body means it's exactly what it sounds like. It's fat. It's a big tongue. Often we'll talk about scallops on the side of the tongue, because the tongue is so large it presses up against the teeth and it scallops the edges of the tongue. A sticky tongue coating is indicative of dampness and phlegm. So sticky is you just look at a bunch of tongues and you realize what's a sticky tongue. A sticky tongue coating. And the slippery or wiry pulse. So these are technical pulse descriptions. A slippery pulse is often described as a string of pearls being pulled under your fingertips. So it's very rounded and smooth, and not exactly a normal pulse. It's a little bit too rounded, and that's a slippery pulse. A wiry pulse, I've heard it described several different ways. One of my pulse mentors said it's when all three positions, we do the pulse in three different positions. All three positions hit the fingertips at the same time. Others talk about it as like a guitar string, though the differences between wiry pulse and tight pulse can be a little bit difficult to really suss out sometimes. But a wiry pulse is a common pulse and can be indicative of phlegm as well. Other symptoms may include a feeling of oppression of the chest, nausea, a feeling of heaviness, a feeling of muzziness or fuzziness of the head, and dizziness. These are all signs of phlegm. Other signs of chronic phlegm include lack of luster, and it has here in parentheses Shen. Again, these are quotes from Maciocia, and Shen is translated often as spirit. And so when we say lack of luster or Shen of the eyes, what we're saying is the eyes are dull. We often will look in the eyes to see if there's Shen or spirit behind them, and it's again one of those concepts when you look at hundreds of eyes, you kind of get to the point where you know when there's Shen behind it and when there isn't. But trying to describe it is, for me, not easy to do. I'm not a very visual person, so it's hard for me to describe this sort of things. But that's what we're talking about, sort of lack of luster or Shen of the eyes. Dark eye sockets. Corners of the eyes have very slight cracks with exudate. So exudate in general is a sign of phlegm, potentially a sign of phlegm. Sallow complexion, so sort of a white-yellow complexion. Swollen body, puffy face. Obesity is just in and of itself a potential sign for phlegm. Though I wouldn't say obesity means phlegm, I would say that phlegm can engender obesity would be a better way to say it. So you can be obese and not have lots of phlegm, though you definitely, in all likelihood, have a propensity towards it. Greasy skin, sweaty external genitalia, axillae or palms and soles. So sweaty axilla, which is below is your underarm or palms and soles. Enlarged fingers and toes and thick thumbs. So just a general swelling sort of idea here. Some sayings and findings about phlegm include, and these are again all from Maciocia. Phlegm is a yin pathogenic factor and it injures yang. We have talked about yin and yang previously, so it's important for us to understand this, that it's a pathology of yin that injures yang. And that makes sense because yin are our fluids. So if there's something wrong with the fluids like there is in phlegm, it's certainly going to affect yin. Phlegm is sticky and obstructs the qi mechanism, so things don't move smoothly as they should. Phlegm causes lumps, so lots of, what we'd say maybe nodules in the body could be phlegm related, and often phlegm is associated with those from a Chinese perspective. Phlegm flows and moves, always changing. In other words, just when you think you have it nailed down, it ends up somewhere else. Phlegm often harbors stasis. So phlegm is sort of, because it obstructs that qi mechanism, it prevents the smooth flow of qi and can cause stasis or stagnation. Phlegm is the origin of many diseases. Many diseases have phlegm. It's a very Chinese construct. So phlegm is involved in a lot of things. Phlegm easily damages the stomach and spleen because those are the digestive organs, and phlegm will interfere with proper digestion. And phlegm easily mixes with other pathogenic factors, so you'll often get combinations of things. So it's common, like with cancer, more often than not, it's a combination of phlegm and blood stasis and qi stagnation, all these sort of things in a big ball. So it mixes relatively easily with other pathogenic factors. So according to Maciocia, here are some important guidelines involving phlegm. In strange diseases, treat phlegm. This refers to complicated clinical patterns with symptoms and signs that do not seem to fit into any pattern. So if you don't know what you're looking at, think phlegm. In complicated syndromes, treat phlegm. I like this. One of my rules, my personal rules clinically is if something is very complicated, treat it very simply. In other words, don't treat complex situations with complex treatments. You want it simple. You want, the body's getting mixed up with a lot of different messages. Give it one simple message. And more than not, phlegm is a great simple message to give in that scenario. So in complicated syndromes, forget everything else. Just treat phlegm, because once phlegm starts to go, everything else will unwind itself. It'll become unstuck. In acute serious diseases, treat phlegm. So examples include wind stroke, which is what we call in Chinese medicine cerebral vascular accident or a stroke, an actual stroke, but we call it a wind stroke. Heart infarction, which is a heart attack, and cancer. So in acute serious diseases, treat phlegm. So they will be involved in a lot of those very serious diseases. And finally, if you see phlegm, treat phlegm. And what that means is when you see phlegm, that means physically see phlegm. If you are coughing up phlegm and things along those lines, treat phlegm. Phlegm is interesting. We didn't actually get into it in this little thing, but there's two types of phlegm in Chinese medicine. We call it substantial phlegm and insubstantial phlegm. So substantial phlegm is that phlegm you can see, and that is phlegm, as we're discussing here. But then we also have this sort of insubstantial phlegm that is more of a theoretical medical construct in my mind than an actual physical thing. I think it's a very useful construct, and I do that. But that's what we're talking about with these complicated cases, these serious diseases, is probably more that insubstantial phlegm rather than anything substantial that you will see. It is obvious from this short introduction that phlegm is an important pathogen in Chinese medicine. And that leads us to today's formula, Chen Tang. It's not the only formula for phlegm, but it is among the most important, and many of the other phlegm formulas are based on this one formula. So, without further ado, let's get into Chen Tang. So remember, with formulas, I have two major textbooks that I work out of, and then of course I supplement those with lots of other sources. The first of those is Scheid and his team, and this is a very foundational book. It's the one. It's an update, but it's the one that I learned when going through formulas in Chinese medical school. And he talks about, or that team talks about, the name of Chen Tang. The name of this is a quote. The name of this formula indicates that the two chief herbs, unlike most other herbs, become more effective when they have been stored for some time, because this makes their action less harsh. As noted in medical formulas collected and analyzed, aged Citri reticulate pericarpium, or Chen P, and Pinellia rhizoma preparatum gerbansau are highly valued because there's no worry about their drying and dispersing natures. So these are both drying and dispersing, but if they're aged, cured, quote, aged or cured, then they become less dispersing and drying and are highly valued. Hence, the formula has two aged in its name. So that's where we're coming from. That's why the names of these of the formula is that they're aged to prevent too much drying and dispersing in these two herbs. And we're going to find out those are two very important herbs in this formula. Other names for this formula are Chen Wan. Tiang means decoction, Wan means pill. So Chen Wan means two cured pill or two aged pills. You might also see the same exact Chen Tang, but spelled E-R-H rather than E-R. Again, the same thing, it's just a different way of translating a Chinese character into Latinized alphabet. And so they're both it's the exact same word, just one I think is Wei Giles and the other one's definitely Pinyin. You also be called Tu Chen decoction or pill, Tu vintage herbs decoction, and sometimes in a pure English translation, citrus and Pinellia combination. Citrus being that Chen P that we were talking about, and Pinellia being that Gerban Sha that we're going to get into. So citrus and Pinellia combination. This formula is in the category of formulas that dry dampness and transform phlegm. So you noticed in my conversation about phlegm, I mentioned dampness quite a bit, because dampness is on a continuum. I like to say it's on a continuum of phlegm. At one end, there's dampness, and the other end, there's very congealed solid phlegm, and in between those two is a continuum. So we often will treat both at the same time. So formulas that dry dampness and transform phlegm. And Chen and Chen, which is the other textbook that I use, translates this as damp drying and phlegm dissolving formula. So similar, but slightly different translation. Scheid says this formula dries dampness, transforms phlegm, regulates the qi, and harmonizes the middle burner. So these are all very Chinese Chinese related concepts. So dries dampness makes a lot of sense. If you're drying phlegm, you're drying dampness. Transforms phlegm, rather than dry. This word transform has some really interesting connotations to it. But the idea is we're changing phlegm into something that's a little bit more easier for the body to deal with. Regulates the qi, which means it moves the qi, and phlegm is going to stop qi from moving. So that's a really important concept here. And harmonizes the middle burner. The middle burner is where our digestive organs are. That's where the liver is as well. And this is, helps the liver a little bit too. That regulate the qi is often an issue around the liver because the liver moves, his job is to move qi. So harmonizes the middle burner, kind of make sure that everything's in harmony in that middle burner. So that's a really positive sort of thing. Chen very similarly says it dries dampness and dissolves phlegm, and regulates qi and harmonizes the middle jiao or burner. Jiao is just the Chinese term for burner. So very, very, very similar actions between the two books, which doesn't always happen. So when it does, you go, wow, okay, interesting. So those are the Chinese medical actions for this formula. And then now we talk about the indications. So these are kind of the actions are what the formula does. The indications are what we'll see, what we see in a patient before we think about using this formula. So it's sort of a different perspective on it. So Scheid and his team says this formula can be used for, quote, coughing with copious white sputum that is easily expectorated, focal distension and a stifling sensation in the chest and diaphragm, palpitations or an unusual awareness of your heartbeat, nausea or vomiting, dizziness, a white, moist, or greasy tongue coating. Remember I said one of the signs of phlegm is a sticky tongue coating. Another way we say that in Chinese medicine is greasy. And I kind of like greasy. It makes it a little bit easier for me to visualize what the tongue looks like. So greasy tongue coating and a slippery pulse. We mentioned that slippery pulse earlier when we were talking about phlegm. They continue. This is a phlegm dampness pattern usually caused when the spleen and lungs fail to transform and transport the fluids, which thereupon accumulate and form phlegm. The accumulation of phlegm dampness in turn encumbers the spleen, bogs it down basically, which further impedes the transportation of fluids. They continue. Phlegm obstructs the qi mechanisms of the middle burner, which manifests as focal distension, so a feeling of bloating, sort of focal distension, and a stifling sensation in the chest and diaphragm, and palpitations. Phlegm follows the flow of qi upward to the lungs, where it interferes with its qi mechanisms and produces coughing. Because the process that generates the phlegm is one caused by excess dampness, the sputum is copious, white, and easily expectorated. Phlegm also interferes with the normal descent of the stomach qi, which leads to nausea or vomiting. The presence of phlegm in the middle burner obstructs the ascent of the clear yang and causes dizziness. The slippery pulse and the white, moist, or greasy tongue coating are indicative of phlegm dampness. So lots of technical sort of terms in there, but I think even if you're not super technical in the Chinese medical terminology, still makes generally a good deal of sense in how this happens. Chen and Chen state it can be used for damp phlegm accumulation, including profuse white sputum that can be easily expectorated. So very same thing as Scheid and his team. Feeling of distension and a stifling sensation in the chest and epigastrium, nausea, vomiting, lassitude, so just a general feeling of not wanting to do much, lassitude, weak extremities, possible vertigo, palpitations, white, moist tongue coating, and a slippery pulse. So very similar, slightly different, very slightly different, but very similar in how it describes what's going on. Let's talk a little bit about the history of Chen Tang. So Scheid and his team says the source for this formula is the formulary of the pharmacy service for benefiting the people in the Taiping era from 1148. Keep that date in mind, 1148. Chen and Chen say the formula was first mentioned in the Taiping Hui Min He Ji Ju Feng, and they translated Imperial Grace Formulary of the Taiping era. These are the same book, exactly the same book. Different translations of the Chinese. So, but here's the thing: is they say it was written in 1078 to 85, while Scheid says it was written in 1148. So there's 70 years difference there. That's a big difference in when this is. And of course that could be a historical, history doesn't know exactly where it is, and they have different sources. But what's even more interesting is let's go on. These both refer to the same book, but they have different translations and dates ascribed to it. In fact, Scheid in the back of the book. So Scheid's interesting when they're talking about which book it first appeared in. It just gives the English, which is what I have here, the Formulary of the Pharmacy Service for Benefiting the People of the Typing Era. But in the back of the book, it lists the actual Chinese book, and so I looked that up. It was the exact same Chinese name. That's why I can say this is the same book. But what was very interesting is when it quoted it for this formula, it said it was written in 1148. When I looked in the back, it said it was from 1107, so almost 40 years earlier. And that gives us a third date for when this book is. So we have, for this book, 1078 to 85, 1107, and 1148. So there's a 70-year pocket window here where this book came out. These days, that's probably not a huge issue. It's over 1,000. It's about 1,000 years old, give or take. A little less, but in that 950 years old. Doesn't really matter, 50, 70 years. Probably not. But I just thought it was interesting that we couldn't even pin down an exact date as to when this book was written. But then again, it's 1,000 years. So let's get into the ingredients of this. And there are 4 main ingredients and then a couple others that may or may not be included. And we'll talk about all that. So the first ingredient is that Pinellia. The Latin is Pinellia rhizoma preparatum, which actually means prepared rhizome of Pinellia. And in Chinese, this is zhi, ban, xia, all 4th tones in the Chinese there. And you use a pretty hefty dose of this, in this case, 15 grams. And this is from this herb is from the category of herbs of warm herbs that transform cold phlegm. So again, good phlegm transforming sort of herb here. And this is one of the chief herbs, according to Scheid. It dries dampness, expels phlegm, and causes the rebellious stomach qi to descend, according to Scheid. Chen says it is the sole chief, so there is only one chief, and this is it, herb of this formula. So we break down formulas into different categories, and this is the chief herb, or emperor herb, sometimes it's translated as. And they say its acrid and warm properties can dissolve phlegm, dry dampness, and open pathways for the qi to flow. So that sounds like it takes care of a lot alone. This takes care of a lot of what the formula actions are, and that's why it's the chief herb. Let's move on to the second herb, and this herb is a little controversial. So Citri reticulate exocarpium rubrum, which is Ju Hong, both second tone, both second tone. And again, 15 grams of this. Again, not a bad dose, but a little hefty. But we're going to find out when in decoctions we lower the dose a little bit. We'll talk about that in just a minute with preparations. So this is from the herbs that regulate the qi. So this is very good for helping that. Remember, phlegm obstructs the qi mechanism. Regulating the qi is how you deal with that obstruction. So Scheid and his team say the other chief ingredient is Juhong or Citri reticulate pericarpium Chen Pi. So here's the other thing. So Juhong Chen Pi. I've mentioned Chen Pi a couple times already. Traditionally, it's Juhong. We're going to talk about why there may be a bit of a difference between those two in just a minute. And so the other chief ingredient is Juhong or Chen Pi, whose fragrance revives the spleen and facilitates the flow of qi in the middle burner. Its acrid flavor disperses clumped qi, while its bitter warmth disperses cold and dries dampness. So again, we have some damp drying there, which is useful for this formula, and it disperses qi, it regulates qi. That's very useful for this formula. Chen says it activates and regulates qi to remove residual phlegm and dampness. So again, very similar to that. Now, Chen, I'll be honest with you, so Scheid is usually very, and their team is very specific about what is the emperor herb or the chief herb and what are the envoys and deputies and assistant herbs. Chen is a little bit looser with that. They often will say what the chief herb or what they think the chief herb is, but not say what the rest of the herbs are. And that's fine. This is controversial, and different sources will give you different chiefs and different assistants and different deputies. And so it's controversial in general. We always had to memorize it for our board exams. It was the one thing I didn't really do a lot of brain space with, just because each book kind of said something a little different, and I just felt it was just not something that was worth memorizing. And still to this day, one of my mentors, herb mentors, really, really great at herbs, Bob Damone, was really disliked this as an approach to understanding formula. So I'm kind of in that camp of things these days. So that was the second herb. Our third herb is Poria or Fu Ling. We need 9 grams of this. And this is not just from, it's probably the big herb in the category of draining dampness herbs, just like Chen Pi is the big herb in regulate qi herbs, and Zhibanxia is the big herb in warm and cold phlegm herbs. So these are all big herbs in Chinese medicine. So Fuling Poria, Scheid states that this is the deputy herb and supports the actions of the chief ingredients by leaching out dampness from the middle burner and strengthening the spleen. It also resolves the palpitations and dizziness caused by the upward rising phlegm dampness. Chen says it strengthens the spleen and dispels dampness. And those really are the functions of Fuling. So very strong in those functions as well. Very good. So it's dampness rather than phlegm, but remember, it's on a continuum. So draining damp is going to help the phlegm as well. Next up, and our fourth of the 4 big ones, is Glycyrrhizae radix preparata, or prepared licorice root. And Chinese for this is Zhigan Cao. We need 4.5 grams of this. And this is from herbs that tonify qi. So that's a little bit different than what we've been doing so far. Scheid and his team say this is an assistant herb that tonifies the spleen. So it kind of assists everything, but it's not main in the functions. Chen say it harmonizes all of the herbs and regulates the lung and spleen. So it's an interesting herb. Very, 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 I would say this is probably the most used herb in Chinese medicine. So super important herb. And it's often put into formulas to do that harmonizing. It has this ability to harmonize other herbs. So it's often in it for that rationale. So there we go. Those are the 4 big ones. So we're going to take a little step off now from talking about the ingredients specifically, and we're going to talk a little bit about preparation, and then we're going to get back to the last 2 potential ingredients here. So let's do that. So standard preparation, and by standard I kind of mean traditional. Traditional preparation for this formula is to grind these 4 ingredients and take 12 grams as a draft. So a draft is basically, there's a couple ways. You can put it in hot water and then drink it. Or the other thing is you can just put the powder and then wash it down with some hot water. So that's a draft. So 12 grams as a draft with 7 pieces of Zingiberis rhizoma recens, or Shengjiang, which is fresh ginger. So 7 pieces. So when we say a piece, we're really talking about a quarter-sized piece, maybe a little thicker than a quarter. So that's a lot of ginger. So you're supposed to take it as a draft with that, and 1 piece of Mume fructus, or Wu Mei, which is a dried plum, basically, and that's Mume fructus. And by dried plum, it's a specific, species of plum that's used for that. So those are the 2 other herbs that we haven't mentioned yet: is fresh ginger and this Wu Mei or plum. We're going to get into those in just a minute, what they can do. But here's the reason why I'm kind of doing it this way. Most modern renditions of this formula do not include these 2 additions and replaces that Citri reticulate exocarpium rubrum, the Juhong, with Citri reticulate pericarpium, or Chen Pi. Generally, Chen Pi is much more readily available. It's not as expensive. Juhong isn't that expensive. Chen Pi is getting more expensive, but still, it's not bad. So we generally use Chen Pi. And of course, when I'm going through this, I'm like, why would we do that just so basically. So I looked it up. Juhong, according to Bensky, which is one of the main texts for individual herbs, and his team, Bensky and his team, is more drying and aromatic than Chen Pi, but less effective in harmonizing the middle and regulating the stomach and spleen. So if you have a lot of fluids, you might want to be a little bit better with the Juhong. But if you want to do more of the harmonizing and regulating aspects, you want more of the Chen Pi. And so generally, I think modern prescriptions are more on the Chen Pi side of things with this. And that happens a lot. The herbs properties will change over thousands of years as these have been cultivated and used. And so in general, we use Chen Pi today rather than Juhong, even though traditionally Juhong is the proper herb to use. And finally, if we are making a decoction out of this formula, we should reduce the doses I just gave you by a third. So instead of 15 grams of Zhiban Xiao, we should be using 10 grams. And that's a more traditional amount. Same with, it was 15 grams for Chen Pi, and we should use 10 grams. And usually we use, for some reason, traditionally, because of the way it breaks down, we usually use things in 6 or 9 grams in 3 gram increments. So 9 grams is a typical dose for both of those herbs. So 10 grams, a lot of people will just say 10 grams, and that's fine. So right in there. So that's what we'd use in a decoction, which is boiling the herbs, draining them, and then drinking the liquid that's left over. That's a decoction. All right, so back to those last two ingredients, Zingiberis rhizoma recens, Shenjiang, which, like I said, is not used necessarily in modern formulations of this, though it can be, and there's no reason not to. And this is from the warm acrid herbs that release the exterior category of herbs, so not really on the surface a category of herbs that we think would be relevant for phlegm, but it's useful here. And Scheid says it's an envoy herb, so they say may be added as an envoy to reinforce the actions of the chief herbs in moving the qi and eliminating the phlegm, harmonizing the stomach and controlling the nausea. So ginger is great for nausea, and it's another harmonizing herb. We have 3 herbs that we say are harmonizing, and often all 3 are in a formula. That's ginger, licorice, as we already mentioned, and Chinese dates, dazhao is the 3rd one. Those are often those are in a lot of formulas to do this harmonizing and to make sure the other herbs are done well. And one of the things we're going to find out is Zhiban Xiao, the Pinellia, is a toxic herb, which is why we prepare it to minimize that toxins in that herb. But it's also why we might want to have some harmonizing herbs to kind of smooth out the toxins in that. We often will do that. Harmonizing is very useful as a way to deal with toxic herbs. Chen says this herb relieves nausea and vomiting by guiding stomach qi downward and helps to detoxify the Zhiban Xiao. So that's an interest that Pinellia. In fact, prepared Pinellia often uses ginger juice in the preparation, so it makes sense that would be in line here. So that's our fresh ginger. Let's move on to the mume fructus, or the wume, which is plum, is dried plum. It's 1 piece. This is an herb that's in stabilize and bind, which on the surface, again, you would not want to use in a phlegm condition. Phlegm is a binding pathogen. You don't want to bind something when you have phlegm. So this is interesting that this is used in this formula. So let's figure out why that might be the case. And actually, it shows a very traditional sort of approach to a formula. So according to Scheid and his team, it counterbalances the dispersing tendencies of the chief ingredients and thereby prevents the dissipation of lung qi. Its astringent nature also acts to collect the phlegm together before it can be eliminated. Chen says, since patients with this syndrome already have qi deficiency, a very small amount, and this is a small amount, of wume is used to astringe the lung to prevent qi loss. The restraining effect of wume also balances the dispersing nature of Zhiban Xiao, thereby minimizing the potential side effects of both herbs. So that's really how we look at this, is just to make sure we don't go too far in one direction with the other herbs. And we do that a lot in formulas, is we'll throw in something that's the exact opposite of what we're trying to accomplish, just to make sure that we don't What I like to say is herbs and formulas can be very pushy in their actions. In other words, an acupuncture, if you get an acupuncture point wrong, it's usually okay. The body kind of knows what it's doing. And it's not acupuncture to me is not a pushy modality, but herbs can be very pushy. In other words, even if your body doesn't want something to occur, an herb can push it to do that anyways, and it can cause more harm. And in fact, if you look at the history of herbs, there's a lot of history that says my book is an antidote to what everyone else is doing wrong, in Chinese herbology, because they are pushy. You can cause things to go bad, and so that's why throwing in a little bit of the opposite of what you're trying to do is very regulatory and kind of prevents too much pushiness in an herbal formula. And this is a relatively pushy herbal formula, so this Wu Mei kind of balances out a little bit. It balances that out a little bit, which I really like. All right, there's lots of commentary about this formula. Scheid has a very long commentary. Not talking about all of it. Haven't included all that, but I've included some of it that I wanted to talk about here. And this is from Scheid. A lot of it is quotes from Scheid. And of course, I'll throw in my own comments as we go along. So Scheid and his team says, this formula serves as the foundation for literally dozens of other formulas that address the problem of phlegm. Again, as I said, this is a foundational formula, so that's it. They continue, the close connection between spleen deficiency and phlegm is illustrated by the fact that with the addition of ginseng radix, ren shen, and Atractylotus macrocephalae rhizoma, or baiju, this formula is transformed into 6 gentleman decoction, or Liu Junzitang, one of my favorite formulas, which is one of the principal formulas for tonifying the qi. So in other words, all you do is add in 2 qi tonifiers, and now this is a qi tonifying formula, a relatively balanced qi tonifier. In terms of its functions, however, Chen Tang is a qi regulating formula and is thus indicated for excess patterns, following a famous adage first expressed by Pang An Chang in Indispensable Tools for Pattern Treatment. He says, experts in treating phlegm treat the qi, not the phlegm. Once the qi is normalized, the fluids of the entire body follow the qi and are also normalized. That's a very interesting concept. So don't treat the phlegm, treat the qi. Interesting. Historically, this formula can be viewed as a combination of minor Pinellia plus Poria decoction, or Xiao Bansha Jia Fuling Tang, and Pinellia and Magnolia bark decoction, or Bansha Hopo Tang, from Essentials from the Golden Cabinet. So Essentials from the Golden Cabinet is which is part of the same book as the Shenghen Lung. They were split into 2 books later on in history, but they were originally one book. That is the first existing book on formulas. So this is a combination of 2 very old formulas. Both of these are qi regulating formulas. The former treating phlegm and thin mucus in the epigastrium and diaphragmatic region, and the latter treating qi stagnation leading to phlegm in the throat and chest. So interesting. So they're qi movers, but again, it goes to that idea of if you move the qi, the phlegm will move as well. Other physicians expanded the use of this formula to include such diverse problems as excessive drooling in children, diarrhea, stomach pain, insomnia, as well as hypersomnia, so too little, not being able to sleep, and too much sleep, menstrual disorders, infertility, and emotional constraint, to name but a few. That this formula is, at the most fundamental level, for regulating the qi dynamic and fluid metabolism, can also be seen in its putatively less important ingredients, the assistant and envoy herbs. There you go. They continue. Several commentators, such as Chen Yanzhu in Compendium of Songs on Modern Formulas and Tang Zong Hai in Discussion of Blood Patterns, argue that because all phlegm is a pathological transformation of water, Fu Ling should be viewed as the main herb in this formula. Interesting. Considering just the relative dosage of the ingredients, this is probably incorrect. In other words, we'd expect a higher dose of Fu Ling if that were the case here. But it does point to the importance in the treatment of phlegm disorders of reordering the fluid metabolism throughout the triple burner. So again, triple burner is an interesting organ in Chinese medicine that does not have any corollary in Western medicine. And usually, I think the easiest way to kind of think of the triple burner is that its most important function is in fluid metabolism and moving qi and fluids around in the main body. At some point, we'll have a big discussion on the triple burner, which I'm not looking forward to because it's a tough concept because we don't have any corollaries in Western medicine. All right, so Scheid and his team continues. This applies as well to the use of Shenjiang and Wu Mei. Some writers, such as Wang Ang, in medical formulas collected and analyzed, and the authors of the 1964 standard textbook, Chinese Medical Formulas, consider these herbs superfluous, in other words, not necessary. But others, such as Li Fei and his colleagues in the most recent edition of Formulas, instead define them as exemplars of the subtleties of classical formula composition, and that they focus on the lungs rather than the spleen to add a second prong to the regulation of qi and fluids. An interesting combat between different commentators. The acrid warming nature of Shenjiang promotes the qi dynamic and thereby helps to eliminate pathological fluids. Wu Mei balances this dispersing action of the main herbs by means of its sourness while compensating for the loss of pathological fluids through coughing, increased urination, and sweating by protecting and generating physiological fluids. So in other words, it's compensating for loss of pathological fluids by protecting and generating normal or physiological fluids. So very interesting, very subtle, complex formula. I love these small formulas that have a lot of different layers to them, and this is definitely one of those formulas. Chen also has some commentary on this formula and says, Chen Tang is the basic formula for treating damp phlegm. According to traditional Chinese medicine theory, the spleen sends up clear fluids to the upper jiao or upper burner. Remember, there's three burners. There's the upper, middle, and lower. If this function is impaired, dampness may accumulate in the spleen and create phlegm. Thus, damp phlegm syndromes usually result from spleen deficiency or dysfunction. If the spleen is deficient and full of dampness, its functions of transportation and transformation will be impaired, which will lead to insufficient supply of nutrients to the body and the extremities. The result will be lassitude and weak extremities. The lung, on the other hand, stores phlegm. Phlegm accumulation in the lung manifests as coughing with profuse sputum. A feeling of distension and oppression in the chest and epigastrium arises as a result of damp phlegm obstructing the chest. Nausea and vomiting are due to damp phlegm obstructing stomach qi and causing it to rise abnormally. If damp phlegm affects the ascent of yang qi, then palpitations and vertigo can occur. So interesting commentaries that kind of suss out and help explain why this formula works in the way it does. Now let's talk about modifications. Many modifications as well as important derivative formulas are based on this formula. As mentioned, Six Gentlemen Decoction Liu Zhenzitang is a major and important derived formula. Interesting, warm gallbladder decoction or Wendong Tang actually predates Chen Tang but has similar ingredients. It's not as specific for damp phlegm. It's a very useful formula for a lot of reasons, but not for the exact same reasons for Chen Tang. Scheid and his team list several associated formulas, including Six Gentlemen of Metal and Water Decoction, or Jin Shui Liu Jun Jian, Regulate the Middle and Transform Phlegm Pill, or Li Zhong Hua Tan Wan, Six Serenity Decoction, or Liu An Jian, an Augmented Two-Aged Herb Decoction, or Jia Wei Chen Tang. We'll see Jia Wei quite a bit, and that just literally means additions and subtractions, and it's often translated as augmented, so changed. Chen also has several related formulae. These include Dao Tang, or Guide Out Phlegm Decoction, a much stronger formula for eliminating phlegm. Ditan Tang, Scour Phlegm Decoction, eliminates phlegm and opens the sensory orifices. So one of the things that phlegm can do is dull the orifice or block, mist the orifices, and that's not a good thing. That's often goes down into mania and schizophrenia. So we want to make sure those orifices are open. So Tang scour phlegm decoction is useful for that. It's used mostly for post-stroke patients with a stiff tongue and speech difficulties. So when those orifices are blocked, that has very similar. I said mania and schizophrenia, but also post-stroke as well. Chen Tang are 2 cured decoction with aurantium and cardamom. Eliminates phlegm, regulates qi circulation, and relieves pain. It treats severe radiating pain in the chest with violent nausea and vomiting. So those are associated formula according to Chen. Comparisons. Let's compare these to a couple other formulas, and we're going to compare some of these. So both guide out phlegm decoction Dao Tan Tang, which we just mentioned, and Chen Tang, according to Shai, treat patterns caused by phlegm dampness obstructing the qi dynamic. But while Dao Tan Tang is a base formula that can be modified according to the precise manifestations, Chen Tang is for conditions with more severe phlegm and constriction of qi, which may suddenly discharge as wind, causing collapse or manifest with wind-like symptoms such as headache and dizziness. We're not going to talk. We've talked about wind in previous Sperb herbs, but we won't talk about that here. What's interesting about this is Chen disagree with this and actually believe Dao Tan Tang is a much stronger formula than Chen Tang. So we have battles of the textbooks here. One textbook says the Chen Tang is stronger. The other textbook says Dao Tan Tang is stronger. It's very interesting. I'm not going to be the one to referee that, but always love to find these discrepancies. Always spurs further research, not necessarily right now, but in general, I've had patience. I'm trying to decide between these two formulas. So that's really the main comparison here. Some biomedical indications for this. This formula is used for several biomedical conditions, including chronic bronchitis, Meniere's disease, and pleurisy. If you're not familiar with Meniere's disease, this is tinnitus, a ringing in the ears, along with nausea and vomiting and dizziness. So that's Meniere's, a very disconcerting disease, not a fun disease, and difficult to actually treat because phlegm is difficult to treat. So this could be useful for that. And pleurisy is painful. The pleura are what line the inside of the lung and the outside of inside of the lung space and the outside of the actual lung. And when that gets inflamed, you have pleurisy, which can be very painful. Chen say it can treat upper respiratory tract infection, bronchitis, tracheitis, or infection or inflammation of the trachea, emphysema, gastritis, peptic ulcer disease, gastrointestinal neurosis, nausea, vomiting, goiter, which is the thyroid, Meniere's disease again, seizures, and hangovers. That this could be useful for treating hangovers. That's interesting. So a quick look at the science. I did do a brief, review of the literature on it. Didn't come up with much with this formula. Chen lists some Chinese studies in their textbook and showed some benefit to the following conditions: bronchitis, bronchiolitis, atrophic gastritis, diabetes mellitus with a diagnosis of damp heat, seizures, and goiter as well. So goiter, they only had 7. That's not statistically valid. The rest of these aren't huge numbers. I put the N values, which is the number of subjects behind these. So, they range from 7 to 128. So they're not huge numbers. 128 was an atrophic gastritis. So those are interesting. I think they point in a direction, but aren't definitive. I wouldn't necessarily treat these conditions just based on these studies, but it's an interesting look at them. There are a couple drug-herb interactions to be aware of. If you are going to use that ginger potentially interferes with anticoagulants. That was a C-level study, so in humans, but relatively low level for humans. It also appears to inhibit cytochrome P450, 2C9, 2C19, and 3A4. If you don't know what that means, that's fine. That's technical, and I put it in there for those who have been through my drug-herb interaction course. They'll understand that. Gonzal, licorice, may increase blood pressure. That's fairly well established, even though this says level C evidence. There's other indications that it's higher than that. It's definitely well established that it can increase blood pressure on its own. But here in a formula like this, especially when there's a lot of drainage happening, probably not going to affect it too much, but something to be aware of. And Gonzal may also induce cytochrome P450, 2C9, and 3A4. So again, not going to get too much into the cytochrome P450s, but useful for drug-herb interaction risks. Concerns. There are concerns about this formula. Scheid and his team say the improper dose of this formula can lead to excessive thirst and a dry throat. Without modification, it is contraindicated for cases with cough associated with lung yin deficiency. So if you have not enough fluids, your yin is deficient, this is going to drain fluids. So you want to be cautious with that, really cautious with that, or contraindicated. However, in their commentary of this formula, they say the main herb in this formula is intensely drying and therefore contraindicated in patterns characterized by a lack of body fluids. Okay, so this supports that yin thing. However, we're going to get to the however in just a minute. Traditionally, therefore, Zhiban Sha is said to be contraindicated for patterns characterized by thirst, and many physicians prefer to use herbs like Fritillaria bulbus or Beimu and Trichosanthus radix, Tianhuafen, in these cases. So those are herbs that also drain phlegm but aren't quite as dry as the Zhiban Sha. They summarize their concerns by saying, although it is probably inadvisable to use this formula in cases of yin deficiency, as we mentioned, characterized by a severe lack of fluids, dryness alone is not a contraindication. This is because phlegm itself generates dryness, partly by obstructing the movement of qi and fluids, and partly by being itself the pathological product of those body fluids that withdraws their moisture from the body. Transforming and eliminating phlegm thus has the ability to moisten, while both Zhiban Sha and Chen Tang are often combined with moistening and blood tonifying herbs. So it's not an absolute contraindication, but it certainly is a caution if someone's dry or yin deficient. Chen echoes some of these concerns. Chen Tang is acrid and drying is not suitable for cough caused by lung yin deficiency or lung dryness. Similarly, this formula should not be used if the patient has scanty sputum, blood-streaked sputum, or coughing with blood. This formula is acrid, warm, and drying. Short-term use of this formula may be associated with dry mouth and thirst. Long-term use may cause consumption of yin and body fluids. This is probably not a long-term formula. It's like get rid of the phlegm and move on. That could be a little bit difficult. It can take a little while, but that's generally where we want to go with this. All right, so those are the concerns. Let's summarize what we've got here. So that was today's formula, Chen Tang, an excellent and foundational formula for treating phlegm. We started by discussing the internal pathogenic factor phlegm and what it is according to Chinese medicine. And we got into the nitty-gritty of the formula, including its 4 main ingredients with the substitution of Chen Pi for Zhu Hong. Lots of commentary, our concerns and cautions, as well as its potential drug interactions. All in all, a pretty thorough look at this important formula. On our next episode, we are going to be looking at one of my favorite, if a little obscure herbs, hongqiu or red yeast rice. A study of this amazing herb led to amazing insights on cholesterol and constituents and became several of the leading medicines used to treat high cholesterol. Just very useful for that. And as always, we will look at something a little different. So join us in 2 weeks for another interesting episode of Sperb Herbs. Thank you very much for joining me today. As a little reminder, when you buy from Amazon, please use the banner ad on our homepage at spurbsherbs.com. If you like this podcast, please do us a huge favor. Give us a 5-star rating in your favorite podcast app. We would really appreciate that. And by we, I mean me. I'm a one-man band here. I'd really appreciate that. And it would be very helpful and for growing our podcast. Appreciate it. And thank you in advance. As usual, you can always get in touch with me at Dr. Greg at spurbsherbs.com or at our website, www.spurbsherbs.com. And thank you very much. As usual, we have our bibliography. And appreciate you hanging in there. Thank you very much.
Sperb Herbs.
The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Janelle.
Timothy
Nick
Dobbins,
Rogers.
Campbell.